Thanks for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, several African countries are due to benefit from an almost $2 billion program from the World Bank aimed at helping developing nations deal with the effects of the Covid-19 pandemic. Also, thousands of people across Nigeria have been stranded away from home as states across the country shut their borders in a bid to stop the spread of coronavirus. Unease is also ramped up as police are accused of abusing powers in restricting movement. And Rwanda's economic success story risks hitting a huge hurdle as it extends an initially 2-week coronavirus lockdown until April the 19th. But first, Cape Verde, DR Congo, Djibouti, Ethiopia, Ghana and Kenya are amongst the 25 developing countries included in a $1.9 billion COVID-19 emergency response program from the World Bank. The group's hoping to help prop up and reinforce systems in place in Africa to respond to the pandemic. The continent is currently facing over 6,000 confirmed cases of coronavirus, with only 5 out of 54 nations having yet to report infections. Overall, Africa is believed to be the least equipped region in terms of tackling medical emergencies like the coronavirus pandemic. For more on this, I'm joined now by Dr. Mohamed Ali Pate, the World Bank's Global Director for Health, Nutrition and Population. Doctor, thanks very much for speaking to us. But first of all, when it comes to Africa, how do you expect this money from the program to be spent?
Thank you. I think when you see how the pandemic has unfolded in the more developed economies, we have to be extremely ready to respond quickly in the developing countries where the capacities of the health systems are weaker. And also there are other challenges in the backdrop of this pandemic. So these resources that have been approved by the World Bank board today to help countries meet the immediate critical needs first, such as their laboratory capacity, the medical equipment, protecting their health workers, expanding their hospitals' ability to respond to cases, as well as enable containment strategies to mitigate the rise of the cases and, of course, the adverse impact of this pandemic on their societies as well. In addition, there's a component that will enable them to respond to community needs in terms of engaging with community leaders, communicating and maintaining trust. That is very vital in a situation like this, to maintain the trust of communities and to communicate with them in a way that they understand and also follow the directions of the public health authorities. So that's the focus of this immediate support, knowing that there will be need for other sectoral responses, social safety nets, and also the wider economic impact. This is the first phase of the World Bank support.
When one considers, in general, the need to respond to the coronavirus pandemic, we've heard a lot about the needed investment in terms of equipment. But there you mentioned the investment that you're hoping to gear towards community engagement. How important do you think that is specifically in Africa?
I think it's important. Go back to the experience with Ebola on the continent in West Africa, but also in DRC. It's important that community member citizens are engaged as part of the overall public health response. Because at the end of the day, it's behavior of people that will either enable or not enable containment of this pandemic. And that's why there's a component in this response package, in addition to the medical supplies and protecting of human resources in health, the frontline health workers who deal with this disease on a day-to-day. So it's a comprehensive effort to deal with this complex challenge that countries will be facing and building on the responses that we've had in the past and also adapting to the local context. The experiences of, let's say, other parts of the world may not necessarily adapt in the same way with what is going to unfold in Africa. So African countries have to also really factor in that angle of their own community situations and the urban centers and how people are encouraged to change their behaviors in light of the spread of the virus.
You mentioned there the Ebola epidemic, and In considering Africa's readiness to deal with the pandemic, the coronavirus pandemic, we have heard a lot about the fears that overall health infrastructures on the continent aren't up to the task. Do you feel, though, that since the Ebola epidemic, the continent has seen some improvements in terms of preparing for mass outbreaks?
I'll agree that there has been some improvement, but if you recall the evaluation of the core capacities of African health systems even before the COVID pandemic was just slightly more than 2 out of 5 across the continent. That's a joint external evaluation. So yes, there has been improvement, but there are key gaps. Not only that, we have critical gaps in terms of the healthcare system, the intensive care capabilities that will be needed. As I've said earlier, even the more advanced economies have struggled to deal with the demand on their healthcare systems by this pandemic. So where health systems have not been as robust, I think we should expect to see a few more challenges in that regard. And so this response package that the bank has announced is really to enable quickly expand those capacities, but also enable countries to contain the virus, to do social distancing, public health measures, hand washing, to ensure that transmission is slowed down so that the health system that is already weak will not be overwhelmed, and protecting the few health workers who are needed to continue to respond to this.
Thank you very much, Dr. Mohammed Ali Pate from the World Bank there. Now, thousands of people across Nigeria have been stranded away from home as states across the country shut their borders in a bid to stop the spread of coronavirus. It's faced 174 confirmed cases and 2 deaths. Following a lockdown brought in Lagos and Abuja this week, regional governors, have been unilaterally and somewhat haphazardly ordering their own closures. Tensions are also ramping up as police are accused of abusing their powers in restricting movement. Samuel Okoye tells us more.
Had locked down Lagos, Abuja and neighboring Ogun State. But some of the other states in the country are taking some other measures. Many of them have locked their boundaries, which means it is difficult to go in or out of these states. And this is creating a lot of problem. You have people who intend to travel into these states or who intend to travel beyond these states. They are unable to do this. And you've had a build-up of vehicles, a build-up of commuters who are stranded at the borders of some of these states. Some of these issues have been accompanied by human rights abuses. Soldiers, police have been drafted out to maintain the lockdown, and some of these security personnel have actually gone beyond their mandate of controlling people to abuse their rights. The worst of that was recorded today when a youth was shot dead in the Niger Delta city of Warri. It's not clear under what circumstance the soldiers killed the youth, but eyewitnesses said it has to do with the fact that the youth was out at the time he was not supposed to be out. Groups like the Amnesty International, a number of other human rights groups in Nigeria have called on the Nigerian government to, as a matter of urgency, ensure that soldiers and policemen and other security personnel who are supposed to maintain law and order do not go beyond their mandates to maltreat people, harass them. And of course, there's a fear that if you have this harassment of people by the soldiers, most times it has to do with the very poor in the society. If these people are locked in, and you have soldiers harassing them, they are hungry, they don't have money, they cannot walk, and ultimately if soldiers are there to harass them, it could lead to some kind of anger, protest, rioting, and this could actually go beyond what the lockdown was intended.
Sam Olukoya there for us in Abuja. Now, Rwanda has confirmed at least 80 cases of COVID-19. It was the first sub-Saharan African country to bring in a lockdown in response to the pandemic. Well, that has just been extended by 2 weeks to April 19th. The restrictions will weigh heavily on an economy that has been one of the fastest growing on the continent.
Rwanda has imposed one of the strictest lockdowns in Africa. It was put in place on the 21st of March, and the government has just extended it to the 19th of April. The hardest hit are the poorest Rwandans, who used to rely on daily earnings. According to the World Bank, nearly 40% of Rwandans live below the poverty line. Less economic activity has also led to a rise in food prices.
Food transporters are not bringing as much as before, so we have no choice but to increase the prices.
The government says it's providing food aid to 20,000 of the country's most vulnerable. This lady used to rent 2 of her rooms to a hairdresser and a motorcycle taxi driver. Both are now out of work, so she has no more income.
When the lockdown was announced, my 4 kids came back home, and now I have to feed all of them. It's very hard for me, because right now I don't have any source of income.
Chemists and food shops remain open, but public transport has been suspended, a move that once again has mostly hurt the poorest Rwandans. Tensions have risen in some areas. Last week near Kigali, 2 men who weren't respecting the lockdown were shot dead by the police. The officers said it had been a case of self-defense. An investigation is underway.
And the smoke that thunders roars once again. After a dry summer that left Victoria Falls a trickle of its former glory, one of the world's natural wonders is now tumbling magnificently. The falls straddle Zimbabwe and Zambia and suffered in a regional drought, but recent heavy rains have swelled rivers' banks beyond seasonal average. A welcome spectacle, but one to be enjoyed at a distance, unfortunately, for now at least, as viewing areas have been shut as part of the coronavirus fight back. Well, that's it for Eye on Africa. Thanks for joining us. Do so again if you can. Take care.